Dr. Kirsten Lewana coming to you from River Valley Chiropractic, where we teach you to move well so that you can live well. And today we're talking about scars, more likely scars that are post-operative or post-surgery scars on the knees. We get a lot of patients that come in with scars on their elbows, their wrists, their knees from having gone through surgery that have now become tight and painful. But today we're going to focus on the knee. And as you can see, I have scars on my knee from arthroscopic surgery several years ago, more than 10 years ago, that at times continue to be tight and painful. So what causes this, and what is something that we can do to help break up that scar tissue? Well, you'll see on other posts when you look out there on painful scars, you can do things such as self-massage, working on the scar with your hand to loosen up the scar tissue. You don't want to do this right after surgery. This would only be when the scars have healed. Some posts say, more than 2 years after the surgery. I'm saying, probably, within a couple of months, 2-3 months after the surgery, you can start to mobilize, especially with your finger, gently working to prevent that scar tissue buildup underneath the scar. But even if you've done this after surgery and say you're 10-15 years after surgery like me, you can still have tenderness and scar tissue continue to build up under that scar with inflammation that can cause a feeling of tightness in the knee with range of motion, as well as pain to touch, where that skin is just not gliding over that scarred area. So we could start with some finger massage, loosening that up. We could then progress to using like a tennis ball or a racquetball, which has a little more give to it, to work on that scar tissue. But today, for our purposes, we're going to demonstrate using a lacrosse ball, which has not as much give to it and gives a little bit more pressure in there to work on mobilizing that tissue underneath there, breaking up that scar tissue so that we have an easier glide where that scar tissue is to prevent that or get rid of that tight feeling and painful feeling in there. So what you're going to do is you can start with a cross friction. So cross friction is going the opposite directions of the scar. So my scar runs this way. So I'm going back and forth over the top of the scar and working my way across that scar tissue. And you do this to tolerance. It may be painful. So again, like I said, to tolerance, you don't want to sit there in agony while you're doing this. As you work on this and do this on a regular basis, it will get less tender and you'll be able to provide more pressure. So for about 2 to 5 minutes, I'm going to sit there and work cross friction back and forth across that scar. Then I can move to going the same way as the scar runs with the scar, doing the same thing. And once you've done that for a couple minutes, you can even move into the tissue around the scar, because again, inflammation in the area will cause scarring. It's not going to cause scar tissue buildup underneath the skin. That's not always going to be just right under the scar. That can be around the scar as well and cause stiffness and pain. So find the tender areas. Find where it hurts. For me, particularly between this scar and this scar, I have a lot of tenderness right in here. So I can focus on that area and use the ball to break that up. That will allow my skin to glide easier over that tissue so that when I'm moving and doing my exercises, whether it's running or working out, and I'm doing range of motion with my knee, I'm not feeling that tightness in there. That skin is able to glide easily, and less tenderness, less pain, as well as less tenderness to the touch. I wouldn't necessarily recommend doing this on a daily basis, but you could probably do it, every other day, maybe icing in between. If it's too tender, then give another day in between before doing that again. But make it a regular part of your routine to start breaking that up until that stiffness and tenderness has gone away for you. So again, we're just working on that scar tissue buildup that's been caused by inflammation over time or with activity that causes tightness and pain in the knee after a knee surgery or any type of, this is particular to knee scars after surgery. I mean, you can have other types of scars that can cause tightness and pain. So any type of scar that's causing you tightness or pain due to scar tissue buildup, this is a great technique to use to start to break that up so that you get more glide of the skin over that tissue, less tightness and less pain. If you have any questions about this video, go ahead and pop those in the comments below. Don't forget to like and share this video. If you know somebody who's been through knee surgery and is having these type of complaints, share this video with them. It may help. They may find benefit. We thank you for watching. Again, I'm Dr. Kirsten Lewanik, where we teach you, coming from River Valley Chiropractic, where we teach you to move well so that you can live well. Thanks for joining me today. Have a great day. Bye-bye.